Bimini in its last days of a 2-week lockdown. We spoke with Deputy Chief Medical Officer Dr. DeLon Brennan on how things are going health-wise on that island.
Taking a segue to the latest COVID-19 dashboard, the country remaining at 100 confirmed cases now for 5 consecutive days as of May 27th. 46 recoveries, 43 active cases, still 6 hospitalized persons. Tests completed passing the 2,000 mark, now pegged at 2,043, and still 11 deaths. Deputy Chief Medical Officer Dr. DeLon Brennan is joining us today. Good morning, Dr. Brennan.
Good morning, Ms. Allen.
It's now hours away from that 2-week Bimini lockdown ending. Was the measure successful in reducing, tracking, and containing COVID-19 on that island?
So far from the Ministry of Health's understanding of what's going on the island, there have not been any additional persons that have presented with symptoms that would be suggestive of COVID-19. Things appear to be working out well when it comes to people staying inside, staying within their own households, not, sort of socializing with others in the community, receiving the food and things of the like that they need. So those things appear to be going well. Once the lockdown is completed, we will do a round of testing within the community, just doing a sampling to see if we don't see any spread that's actually going on, not just subjectively, but also objectively.
And new developments on the international front, specifically from Italian officials. Following an autopsy of a COVID-19 cadaver, officials there determined that blood clotting was the towering factor in COVID-19 deaths. Hence, they have transformed treatment with prescribed 100 milligram Advil as part of the suite of instruments to help patients. Are local officials utilizing this method?
So what we've noticed over the past few months is that clotting has definitely been a challenge in the scientific literature. It wasn't necessarily known early on, let's say January, February, but as we began to have more cases, especially in the US and the UK, we definitely saw that being a bit of an issue with patients. And so treatment regimens definitely started to include other types of anticoagulants or blood thinners in the use of patients, especially those who were gravely ill or those who had risk factors for clotting disorders. And so that was definitely part of the regimen.
And earlier this week, you indicated some challenges with quarantine patients using the new tracking app. Are there still issues? And overall, what percentage would you say of those patients are now successfully onboarded?
So we definitely had some stumbling blocks initially. I think people just didn't know what the software was. They didn't have an idea as to that this would be a part of it, even though as people are going into quarantine, we give them a set of instructions that include the monitoring aspect. And so persons, I guess, just didn't pay attention to that because it hadn't been rolled out yet. But now that it has, we bring people's attention to it. So it is a lot more successful. We're seeing a lot of people who are participating willingly in the program. We also let people know that the issue is if persons aren't participating in the electronic monitoring of the program, then you'll have persons who will come to your house and evaluate whether you're actually at home or not. If neither one of those is successful, then we have to involve peace officers to engage you, because at that point, we're not sure that you're paying attention and following the rules of quarantine.
And finally, yesterday, information on the added budget allocation for the COVID-19 response from Deputy Prime Minister, the Honorable Peter Turnquest, who noted some efforts toward PPEs and other essential equipment. Tell us, where is funding most needed?
I think one of the things that's going to be most needed for us is really in personnel and making sure that we solidify our human resources, that we are able to do so in a way that makes sure that we have 24/7 coverage. We have people who are able to do the contact tracing, that are able to follow those who are coming from quarantine into quarantine, those who are coming back on repatriation, other international travelers, Bahamian residents who are coming at other times on charter, those who are transiting our family islands. It is an all-encompassing activity that we can't just say is going on from 9 to 5. So you need to bring in additional personnel and recruit other personnel to be able to do this as a 24/7 activity. And so while we don't have a lot of cases, we do need to make sure that we are protecting them while they're doing that activity. But we need to have boots on the ground and these technology solutions and the like rolled out to be able to make sure we're paying attention to what's going on in our community.
Dr. Brennan, again, thank you for your information.
Appreciate it, Mr. Allen.
For the morning edition, Lloyd Allen, ZNS Network News.